The topic of discussion is care in the operating room. Dr. M.A is once again with you to discuss this topic. So let's begin our discussion. After inducing anesthesia to the patient, now we will perform surgery of this patient. So there are certain cares which you take during surgery in the operating room. So first is there are several components of this chapter or this process. The first component is preoperative preparation. Preoperative preparation taken immediately before the surgery. Before surgery. This is first one. The second one is the care which is taken during operation. Third one is when the patient is on the operating table. What care you will take. The fourth one is when the patient is when the patient is post-op, that is after surgery, post-operative care. So we will discuss one by one. First we will discuss what are the preoperative preparation which we do immediately before the surgery. The first one is we gather all information about the patient, all informations of the patient. The second thing is there are certain duties of the surgeon which he should follow. The surgeon should follow the rule which is known as 7 P's. This is a traditional saying which means the first P is prior preparation and planning prevents prior preparation and planning prior preparation and planning prevents profoundly poor performance. If you are having prior planning and preparation, you will perform very good during the surgery. So surgeon should follow this saying. Okay. The third one is the theater staff duty. What are the duties of the theater staff? The theater staff is mostly concerned. Well, first of all is they should prepare the list of the patient. Remember, the group of children is given priority during the surgery, then the diabetic patient, and the other depends on the surgeon and then aesthetics as well as the patient will. So why we give preference to the children or a child? Because to prevent them anxiety before the surgery. So the first duty of the theater staff is to make a list of the patient, prioritize the patient list. The second duty is to arrange equipment and to arrange extra staff if needed, for example a pathologist or a radiologist, and they should also arrange blood and all the investigation of patient to be present in the operating room. This is the duty of theater staff. Then next what we do, we induce the anesthesia. Before inducing the anesthesia, take care of the patient and once again confirm all the details of patient. This is very important. Confirm all the detail, name, address and the disease detail and the investigation. All information should be confirmed. The fifth thing is that when you induce the anesthesia, then you apply catheters if needed and apply tourniquets to prevent blood loss and to provide the surgeon a clear surgical field. So this was all about the first component of the care in the operating room, that is pre-operative preparation taken immediately before the surgery. Thank you very much.